Hello everyone, welcome back to our channel. I'm Mingchen. Today we are going to discuss about bipolar disorder, the evidence of the neural underpinnings, possible ethical issues, and ethical solution of the issues. First and foremost, I would like to start off by introducing bipolar disorder. Bipolar disorder is a mental health condition characterized by extreme mood swings and an inability to perform everyday tasks for an apparent reason. During minor episodes, the individuals might have symptoms such as talking excessively, racing thoughts, hostility, less sleep, and delusions. While during depression episodes, the individuals might feel extreme fatigue, experience prolonged sadness, and memory loss. The severity of these episodes differ from everyone. Therefore, keep in mind that there are certain risk factors can trigger bipolar disorder, such as substance abuse, stressful life events, and genetic physiological factors. There are several types of bipolar disorder, which include bipolar 1 disorder, bipolar 2 disorder, cyclothymia, and bipolar disorder unspecified. Furthermore, in terms of the prevalence of bipolar disorder, the World Health Organization reported that around 40 million of individuals, or 1 in 150 adults, suffered from bipolar disorder in 2019 and is almost evenly common in men and women. Hence, from a physiological psychology perspective, we'll explore how these neural underpinnings contribute to the disorder and the ethical challenges that arise from the treatment. The further parts will be discussed by Jasin and Enchi. Thank you.
Hello everyone, Jasin here, and I will be highlighting on the neural underpinnings about bipolar disorder, as known as BD. There are actually 3 parts here, and I will be covering the first 2. Firstly, immune dysregulation, which is the changes in serum cytokines and immune cells. Talking about cytokines, they are small proteins that regulate the immune cell activity and inflammation. Therefore, they will affect the brain inflammation by passing various neural pathways, which will then cause the behavioral changes of an individual. The different episode in BD would have different changes in their cytokine levels too. Thus, it was found that patients with autoimmune diseases were having higher risk of getting BD, and BD patients were also found to have dysregulated level of cytokines. Whereas for the changes in immune cells, it was observed that NLR and PLR were increased during manic episodes of BD patients. However, the changes vary from severity and duration of BD, as well as the effect of mood-stabilizing drugs if the individual is taking any. Next would be the blood-brain barrier, BBB. BBB involves the uptake of various important chemicals to supply the CNS. Thus, the leakage in BBB would cause the permeability issues, which not only affect the essential uptakes, but also allow loopholes for harmful chemicals, therefore affecting the brain functioning. On the other hand, the NBU, as the central unit of BBB, helps to sustain homeostasis via the regulations of tight junctions in the BBB to ensure the appropriate ion balance and cerebral blood supply. Whereas the BMEC, as the gatekeeper, will bridge the transition zone between the CNS and blood supply. They contain high density of mitochondrial concentration to help with the ATP production, which is important in maintaining the BBB gradients. Thus, BBB will be affected if mitochondrial dysfunction were to be happen. As insulin resistance IR is correlated to the severity of BD, which was proportionate to the severity of leakage in BBB, it was important to highlight that IR affects the vasculature and could change the BMEC, which is the gatekeeper in BBB. Furthermore, the leakage of BBB not only limited to certain brain regions, but is widespread instead, so it will be even faster to worsen the condition of BD. So its effect can be found in a past finding showing that patients with BBB leakage had to go through a more chronic course of treatment as they are significantly more severe in depression, anxiety, IR, and having poorer functioning.
Hi, I'm Enchi, and I will lead you to the role of mitochondrial dysfunction in bipolar disorder. Mitochondria, as known as the powerhouses of the cell, play a crucial role in producing ATP, the energy currency of our cells. In bipolar disorder, as known as BD, research shows that mitochondrial dysfunction is significantly more common, suggesting a potential link to the disorder's complex symptoms. Normally, mitochondria produce energy through oxidative phosphorylation. However, this process is disrupted in BD, leading to reduced ATP production. This impairment affects cellular energy levels, contributing to mood instability and other symptoms of BD. Mitochondrial dysfunction in BD is also linked to increased oxidative stress and inflammation, which can exacerbate the symptoms. Genetic studies further support this, showing that mutations associated with mitochondrial diseases often lead to psychiatric symptoms, including mood disturbances. In the brain, these mitochondrial abnormalities are evident in regions like the frontal cortex, where reduced phosphocreatine levels indicate chronic energy deficits. This contributes to the cognitive and mood disturbances seen in BD, underscoring mitochondrial dysfunction as a crucial neural underpinning of the disorder.
Hello peeps, I'm Weishen, and I'll be talking about one ethical issues encountered in the treatment of bipolar disorder. The use of deep brain stimulation, DBS, has raised significant ethical concerns. Firstly, what is DBS? DBS is a surgical procedure in which electrodes are implanted into certain brain areas. These electrodes will then generate electrical impulses that control abnormal brain activities. Now, I would like to show you a short video on what is DBS.
Deep brain stimulation is a kind of pacemaker. Extremely fine probes are inserted into the proper area, and an electrical pulse is provided to the brain.
Additionally, DBS is said to able to overcome challenges in difficult-to-treat patients, as studies show that 15% of those with bipolar disorder do not respond to usual pharmacological treatment. Coming to why DBS is controversial, this is because the procedure is invasive and carries risks including changes in personality and cognitive functions. Besides, patients that undergo DBS implantations may lose capacity to provide informed consent at later time while treatment is going on. For instance, Mr. Tan underwent DBS implantation. However, 2 years later, his cognitive abilities declined due to his disease progression, which results him unable to fully understand the consent to necessary adjustment in his treatment. This posed an ethical issues in ensuring his ongoing care while respecting his autonomy. Now, we'll move on to ethical recommendations. Thank you.
Hi guys, I'm Lillian and I'll walk you through some ethical solutions to the issues we discussed a while ago that come with deep brain stimulation, otherwise known as DBS. Now, one of the ethical solutions to increase the reliability of DBS is by carefully selecting applicable patients, as this step is one of the hallmarks to avoid the risk of unsatisfactory or unethical outcomes following the DBS surgery. For example, severe comorbidities such as major depression and acute psychosis are considered as an exclusion criteria, and the former may as well be a symptom of bipolar patients. Hence, patients and healthcare providers should discuss on what patients expect from DBS and if presumable benefits outweigh the risk of DBS surgery. This ensures that patients are well informed and can make an informed decision, as well as provide their consent about their treatment in both the surgery and the post-operative period in recovery. This also ensures that the autonomy of an individual is not violated. Secondly, medical professionals should follow the strict guidelines that are in place with regards to this treatment, emphasizing on the focus to minimize harm. For example, it is ideal that patients have no serious medical comorbidities, cognitive deficits, and no untreated behavioral, psychiatric, or mood deficits which will compromise the benefits of DBS or amplify the surgical risk. As such, careful follow-up of patients monitoring hypomanic symptoms and consistent consultations with a multidisciplinary team should be done by medical professionals. This is particularly relevant during the process of adjusting the stimulation settings, especially when risk of hypomania for the patient is the highest.
In conclusion, where physiological psychology provides us with powerful tools to understand and treat bipolar disorder, it also has complex ethical challenges. By adhering to ethical guidelines, we can offer treatments that respect patient autonomy and promote their well-being. As we move forward, let us continue to balance innovation with compassion in treating this complex disorder. Thank you for your watching. We hope this lesson has helped you to gain more insight about bipolar disorder. See you in our next video. Bye!